First of all, new glasses, who this? Hi you guys, and welcome back to Jenean's Journey. And if you're new here, make sure you go ahead and click that subscribe button and turn your bell notifications on so you don't miss an upload. As you can tell by today's title, in today's video I will be talking about nursing clinical must-haves and a few nursing clinical tips from a preceptor standpoint. So if you're interested in watching that video, just keep on watching. So you know what I'm going to say as the first thing on your must-have list is, of course, a stethoscope. You want to make sure you have your stethoscope so you can assess your patients. When you're in clinicals as a nursing student, you will be assessing patients. You may not be assessing patients your first go around, but if I can recall correctly, I did my first clinical rotations in nursing school in a nursing home, and we were just learning how to do like vital signs like blood pressures, counting respirations, temperatures, listening to heart rates and things like that. So we did actually get to practice on real patients, of course, doing my very first clinical rotations. So just make sure you have your stethoscope. I'll insert a picture of me here as a nursing student in my nursing uniform, and my very first stethoscope was one of those, I'm not gonna say cheap, but cheap stethoscope with the double tubes, and it was purple, and I was so excited when I got a blood pressure kit and a stethoscope and purple scissors, purple everything. So I'll insert that picture here. And of course, shameless plug, go ahead and make sure you follow me over on Instagram, because I'm going to pull that picture from Instagram. That's really when I started getting into Instagram, when I started nursing school the first time around, because you guys know I'm in graduate nursing school right now. But make sure you have your stethoscope. The next item you should have, I don't have my nursing diagnosis book anymore. I thought I did, I looked for it. But make sure you take your nursing diagnosis book with you. There will be a little downtime. Your clinical assignment usually is going to entail you doing a full assessment and care plan on at least one patient your first semester or two. And then once you get further along, you will be required to do more assessments and care plans, and of course on paper. So make sure you take your nursing diagnosis books. There's a little downtime so that you can start at the very least. I know when I was in school, I was able to you know, start on my assessment and care plan for my patients during clinical, because the mornings are busy, the beginning of that shift is really busy, but as the afternoon progresses and everyone gets settled and everyone's had their meds and their breakfast, there are moments where you can get to go through the patient's chart. And if you don't have access, which you should, most hospitals go ahead and give their nursing students access so they can go through the patient's charts themselves. Go ahead and start working on your care plan. Don't just sit there doing anything, but make sure you take your nursing diagnosis book so that you can start working on your care plan. Next up, you're going to want to make sure you have your watch, so that you can count your respirations, count your heart rate. Doesn't necessarily have to be, you know, a fancy Apple Watch or anything, because I didn't have an Apple Watch in nursing school. Was not that blessed. And I mean, honestly, Apple Watches are, you know, something new. So you want to make sure you have your watch. I got a little cheapo watch from Walmart, once again purple, because I wanted purple everything. Pink and purple are my favorite colors. So what you want to do is just you know, have a watch so that you can correctly assess heart rate and respiration. And next up, you want to make sure you have some comfy shoes. When I was in nursing school, snips, once again, like all this stuff, these new inventions were not around when I was in nursing school, so you guys should take advantage. But I wore Crocs. We had to wear all white, and once again, I'll insert a picture of me in my all white. And I wore white Crocs, and they were so comfortable. So go ahead and start your comfy shoe collection. All right, next up, make sure you have your badge. Make make sure you have your badge. Your uniform consists of whatever school scrubs that you must have. Every nursing school has a uniform that you must wear to clinical, be it like it was for me, my all whites with my school's symbol on it. Most schools have a uniform or their scrub uniform that you must wear, and make sure you have your badge on, and make sure you just come, you know, fully prepared, because if you don't, I'm not sure how strict they are in nursing school now, but if I didn't have my badge, if I didn't have on my all white, if I didn't have on my white shoes, if I didn't have my stethoscope, if I didn't have my watch, I would get sent home for the day, and I would just miss out on that clinical experience for that day, and you have to somehow make it up. So just make sure you go prepared in whatever it is that you need to wear to nursing school. Next up on my list, and I, you know, once again, going off my nursing school background, my nursing school history from when I was in nursing school as a registered nursing student, I took my drug guide, and it was a Davis drug guide. It was probably like, I don't know, oh, not the 16th edition, but I took my drug guide to work. I took my drug guide to clinical. I took my drug guide to clinical because we had to look up all the medications. So like I said, we did care plans and assessments on one patient, like the first 2 semesters, and then I think the most I did a care plan, like the most patients I did a care plan and assessment on was maybe 2 or 3. And for each one of those patients in your care plan and your assessment, you had to go to their MAR and write down all the medications they were on. After you did that, which is a part of your care plan and your assessment, you have to go through their medications, and you have to write down what it's for, how it works, like just everything, the indications for it, the actions, the pharmacokinetics, which is how is it absorbed, how is it distributed, how is it excreted throughout the body, contraindications, precautions, any adverse reactions, any side effects, the route, the dosage, the correct dosage that you're supposed to give, like what's the max, what's the minimum that you can give to this patient, and what are the nursing implications. So what teaching do you need to provide to the patient about this medication, and how do you give it? Do you give it as an oral drug, PO? Do you give it as an injection, IM, sub-Q? Like, how do you give the medication? And any patient family teaching. So that's really important to have this book just in general for nursing school, but also for nursing clinicals. Go ahead and take it with you so that you can, once again, get a head start and get started on your care plan and your assessment for your patients for that day. All right, next up, clipboard. Go ahead and have you a clipboard. This is from Target. You can get a clipboard literally from anywhere, Hobby Lobby, Michael's, anywhere, Walmart, wherever you shop, you can get a clipboard. A lot of students are carrying these clipboards. I say these, and of course I'll insert a picture here. And these are very convenient because they're a little bit more easier to carry around than this big bad boy here. So what you want to do is make sure you have your clipboard, and of course make sure you have your pen so that you can take report on your patients, and you can write down the necessary information that you need for those patients. And last but not least is go ahead and make sure you have your water cup. So cold. Make sure you have your water cup. Nurses move and they move fast. You do get tired and thirsty, so just make sure you have your water cup. Make sure you stay hydrated. I mean, that's kind of a no-brainer, but not a no-brainer. Just make sure you're staying hydrated. Moving on, moving on, moving on. Alrighty, so next, moving on to the tips. I have lately, since I've been on day shift, I have to precept students if I just so happen to be working a shift that there are students there. So So I've been having to precept a lot of students lately. So I just want to offer you guys a few tips for clinicals from a preceptor standpoint, okay? Do not interrupt report. And what I mean by that is the nurses, we talk pretty fast, and sometimes I'm like, ooh, should I even interrupt and say something, because this nurse is talking too fast for me. But as a nursing student, they're going to be talking in hyper speed to you, and especially if they're using, you know, vernacular, they're using terminology that you are just now learning, so you're not sure what it means. Just hold all your questions to the end of report and ask your preceptor to go over the patient. And what your preceptor usually does is preceptor usually goes back over all the patients for you, so that you can get a better understanding. And I know personally what I do is, once we've gotten to a point where once I've gotten to a point where we're not really doing anything, I'll let you go through the patient's chart. But I do go back over it and give a slower report, a better report, a more in detailed report, so that you can understand. So please, just be willing to help out. Right now, during this pandemic, during COVID-19, we are pretty short-staffed, or not even really short-staffed, just overwhelmed with patients in the hospitals. So what you want to make sure you're doing is just kind of helping out. At the very least, you could do vitals if your preceptor will allow you to do vitals on the patients. As a nursing student, you are allowed to do vitals because it's one of the first things you learn in nursing school. So just be willing to help out, help make a bed, help shower a patient, get trays out of the rooms, clean up the rooms, because those are all things that we have to do. So if you're there for the day, and especially as a helping hand, I know you're there to learn, but this is also a part of being a nurse as well. You want to always make sure your patient's surroundings are clean, make sure their beds are clean, making sure they have baths, making sure they are eating, and making sure they have their vital signs. Making sure their vital signs are done. And those are very simple and easy things that you can do just to help out. So just go in with a great attitude and wanting to help out. Number 4, I just had a nursing student this week. It was just like basically implying that certain tasks are nurse tasks and certain tasks are tech tasks. And that is not the case. As a registered nurse, you are responsible for everything that patient needs during their hospital stay. And what I mean by that is, our techs, they do have responsibilities, but it's our responsibility to make sure they do it. So eyes and O's, getting vitals, changing beds, helping them get to the shower, those are all things that our techs are technically responsible for, but as a registered nurse, you need to make sure it gets done. And you have to remember that your tech, when you do become a nurse, your tech is gonna have double the patients that you have. So this particular day, we had 8 patients total, 4 and 4. So that means my tech had all 8 patients. So that means my tech is responsible for vitals on 8 patients, eyes and nose on 8 patients, making sure 8 patients are eating, are getting their baths, and their beds are changed. So you know what that means. As the nurse, you are supposed to help out. So as a nursing student, once again, I already mentioned making sure you help out before, but I don't want you to have the mentality that your tech does X, Y, and Z and you sit down and you do nothing. Because oftentimes we can just help out as a team, get it done. Previous tip that you are to help out. So just keep that in mind. Even once you become a registered nurse, it's still your task, your duty, your responsibility to help your nurse tech out. If you have any questions, please ask. Don't ask, don't report, but after the report is done or just throughout today, go ahead and ask any questions that you may have. Once again, not assuming you know everything. You're not expected to know everything. And as students, I think we need to get that through our heads that your preceptors aren't expecting you to know every single thing your first day of clinical. They're not expecting you to know everything. So if you have a question, please don't be afraid to ask. Please don't sit there looking confused, because we can see it on your face. Just go ahead and ask a question if you have one. Make sure you come to clinical prepared. What you need to do, know what you need to accomplish, and by that I mean, back to what I was saying earlier in the video, is making sure you have your nursing diagnosing book, making sure you come prepared with whatever it is that you need to do. Know how many patients you need to do an assessment and care plan on, and don't come in expecting the nurse to do it for you. I've had several students that are expecting me to do the work for them. And then that leads me into my next tip is, do not expect your preceptor to do your care plan and your assessment for you. It's okay to ask questions, but there's a fine line in asking questions and then asking me to do it for you, or to ask your preceptor to do it for you. Okay, last tip is to move when your preceptor moves. Nurses move, and they move fast because we have all these patients we need to get through. Practice your physical assessment skills, because you're probably going to have to at least assess one patient, and it shouldn't take any more than 10 minutes, and that's at the very max. It shouldn't take more than 10 minutes to do a full head to toe assessment on the patient. So make sure you know how to do a full physical assessment, do it in a timely fashion. And just in general, when the nurse is going from room to room, we're in and out the rooms, we're moving fast because, you know, we have meds to pass, and of course fast in a safe way, but very fast, very efficiently. So just make sure you're right on your preceptor's tail whenever they are moving. Those are all the tips that I have for you guys today. And as always, thank you so much for tuning in to Jenean's Journey. I hope that you were able to take at least one tip away from this video that was beneficial for you. And I hope you love it enough to where you're subscribed. Make sure your bell notifications are on. But as always, make sure you give this video a thumbs up. Make sure you leave any comments you have. Make sure you leave any comments you have down below. Make sure you subscribe, and make sure you what? Make sure you tell a friend. And I'll see you guys in the next video. Bye. Lord. Dude. All right. Y'all, I hope y'all can hear me. They cut my grass and I'm getting really frustrated right now. I'm trying to finish this video.